This portion of Lifestyles is sponsored by UVet.
Well, I'm at UVet with Dr. Jimmy Yu, and today we're going to talk about something that probably is more common than most of us think, and that's using IV fluids for our pets.
It is.
For what are the circumstances where you would apply IV fluids?
Yeah, it's actually pretty, easy. We know, pets and us, at least 70% we are composed with water, If we are dehydrated or we don't drink enough water, we'll get sick easily. Immune system will kind of be weak, and so fluid is such an important component. When we try to help the patient out, especially when they are sick, if they are throwing up, diarrhea, and they lose a lot of fluid and they don't drink as much, they need fluid.
And so when they come to you, how do you assess? How do you know when a pet needs the IV fluids like this?
So first we will, we'll attempt history from the owner, see if they are throwing up, and roughly how long, and maybe kind of get some idea how much they lost or diarrhea, or if sometimes they are blood loss, if they got into some hit by a car, that's the other thing. And after that, enough history, then we start doing our physical exam, to see. Sometimes we will, pick up their, skin and see if they are really dehydrated or not, and get some, assessment of that. And besides that, we will highly recommend, every sick patient will run a blood work, and blood work will show us, hey, are they anemic? Are their PEG cell volume kind of low? That's also, really kind of dehydration status. And according to that, and if we could reach our diagnosis, from X-ray or ultrasound, then we will, based on this, judgment in general, then we will decide, hey, what kind of, depends on the, the patient, the size of patient too, and then we'll decide what kind of rate we need, then what kind of fluid we need. So you could see there are different kinds of.
So this is what we call ringers, right? And so all of these are the same things you use on people?
It's pretty similar, yes, yeah. Yeah, so we got, saline, sodium chloride. We got, this is ringer with some, sugar dextrose in it. And this is head starch, actually, they look pretty similar, but they are all different components inside them. And this is 3 pounds. Usually we set it up, and of course this angle to the, usually we use IV, which is the most effective way to rehydrate patient in a short period of time.
And I bet you notice the pets perking up pretty quickly when they get those fluids in there.
Absolutely, absolutely. Because if you, this is something pretty easy and we could provide. And if you, diagnose right and get the right assessment, usually they perk up really quick. And a lot of them, actually yesterday we just sent one cat home that had kidney failure and that it perked up so quick, stop vomiting diarrhea and start drinking and eating and walk around like, wow, it's a big difference. It's just one overnight, treatment.
It makes a big difference. So what happens if we don't treat this quickly enough?
If we don't treat quickly, of course, their immune system won't be good. Their liver, kidney, it will be really so dehydrated that their function, chemistry is not functioning well. They will be sick and sicker until, their kind of body deteriorating, and that's not something we like to see.
And this is a really good fix to get the fluids back in the body, isn't it?
Absolutely,
yeah.
absolutely.
Yeah.
Yeah.
So Fluids and More and a Healthy Pet from UVet and Dr. Jimmy Yu and his wonderful staff. We'll be back right after this.
This portion of Lifestyles is sponsored by UVet.